Hello everyone, I'm first going to apologize because I realized probably about the past 3 videos I have posted have been about hormones and injections, and I'm going to do one more today, but I promise this is going to be the last one. I think this is going to be actually the last one. And the reason why I'm filming this today is because the last video I posted on hormones was about doing subcutaneous injections, and I showed you how I did it on myself. Well, I have actually switched back to the intramuscular shot, and the reason for that was I just wasn't feeling good on the subcutaneous injections. I was on them for about 3 months. I felt super depressed, super anxious, really lethargic, and we've tried different dosing and different days and nothing was working. And the day that I went back to the IM shots, within that week, I started feeling like myself again. So for me, subcutaneous just is not working. When I switched back, I did some research and I found a new technique, a technique different than the ones that I've shown in previous videos. And the amazing thing about this technique is I actually don't really feel the shot whatsoever. I don't feel it going in, I don't feel it coming out, and I don't feel any soreness in my muscle after doing it. Now, I've done this 4 times, and all 4 times I have had really no reaction as far as a lot of pain or soreness. And so I decided that I would do a video to show you how the new technique that I'm using that you can try for yourself if you are yourself continuing on the intramuscular injections in your thigh. Alright, I don't have anything for the butt because I've never tried it. It seems too acrobatic for me. So this is for the thigh. So I'm going to take a minute and get everything put together and we're going to get started. Okay. So, as you can see, I have my thigh here, and I'm going to do my right thigh since I'm right-handed. It'll be easier for you all to see on the camera. And I have it stretched out. I don't have the leg in this type of position. Alright, I don't have it like that because then that muscle is going to be tense, and it's harder to inject into, and it can hurt. So, if you relax it, it's going to be a lot looser and easier. In the past, I used to pinch. I was taught to pinch the muscle, inject, release, or inject it, release, and then put the fluid in. And that's what I've been doing for almost 9 years now. But I've seen a new video by a doctor where he says to go in that middle quadrant of your thigh, all right? Take your finger and go here on the outer side. This is the injection site. Press down and then push the muscle apart like this, and then inject in between your fingers. And you're going to have less pain in your injection. He says painless, but I never want to give 100% guarantee, alright? Sometimes it can still hurt, and I'll let you know if it hurts for me as well. So I have the spot, and it always, takes me a second to get going on this. You have it so that the beveled edge, I can't get there. Okay, so you have it so that the beveled end is pointing down, okay? And I found my spot halfway through, and I push down, I push out. And then people go like a dart, or like me, I just gotta go slow. It's just the way it works for me. Okay, I did not feel a thing going in. Alright? You can aspirate if you want. I don't anymore. I mean, I've been doing this for 9 years. I've never had any problems. You inject in. Then you pull it out. And then you can rub it, but if you notice, there's no blood that really comes out either. In the past, with my old technique, there would be blood that came out. So then I massage it for about a minute, maybe less, but I don't feel a thing. It seriously is painless for me when I do this. So I think it's a great option, a great thing to try if you're like me and subcutaneous shots just aren't working, or your doctor's not willing to prescribe it for you yet. So that's now 5 times I've done that technique. I've felt nothing, and I can guarantee you tomorrow I'm not going to feel any soreness in my leg. It's pretty amazing. So give it a try if you want. Send me a message, and I hope that it works for you as well as it has been working for me. Now again, I promise, next video, not on hormones. I'm done. I'm done with hormones. I'm signing out.